Welcome to the University of Louisville Division of Pulmonary Critical Care and Sleep Disorders Medicine. This video will discuss, as a form of orientation, our Pulmonary Critical Care Fellowship. For additional information, please log in to our website and look into the frequently asked questions that has very important information regarding our fellowship. Our division is led by Dr. Mohammed Saad. He has been our section chief since 2018. He was previously the program director for over 10 years, and he currently functions as the associate program director for the Pulmonary Critical Care Fellowship and also the Sleep Fellowship. I am currently the director of the Pulmonary Critical Care Fellowship and also the section chief at the VA hospital. I've been the program director since August of 2018. I was associate program director for 2 years. My main focus has been education and COPD, asthma research, as well as lung cancer research at our VA hospital. You also have an idea, this is kind of my current faculty. As of the recording of this video, we currently interviewing to expand our faculty, so this next few slides are subject to change by the time of the interview season. We have been lucky enough to keep some of our former fellows in as a position for faculty, which is very important. Just to stand out a few of our faculty, Dr. Rodrigo Cavalasi is our ICU director. He's one of our most accomplished research faculty. In addition, he is leading our ultrasound curriculum. We have former section chief, Dr. Fletcher, and our former section chief of the VA, Dr. Guardiola, that recently retired, but still act as graduate faculty. We also have an interventional pulmonary fellowship led by Dr. Umair Kahar. He was recently promoted to professor of medicine. We have a program, a very busy IP program, but we don't have an IP fellowship, which is very good for our pulmonary critical care fellows, so they get to do a lot of our procedures. We also have several subspecialty programs. We have our pulmonary hypertension program led by Dr. Kothari and Dr. Chelly. We also have our sleep program director, Dr. Bobby Moldavanu. He was recently named sleep program director. We have a very good lung transplant program led by Dr. Alan Ramirez and Dr. Alice Ng. Dr. Ng is also the director of our ILD program. And lastly, we have a cystic fibrosis program, which is also led by Dr. Ramirez, and pediatric pulmonology at Adrian O'Hagan. And we recently had an addition from a nephrology critical care fellowship, Dr. Alka Tiagi, which has been heavily involved in the critical care program development, especially the nephrology critical care track. There are add-ons as our faculty, but not part of the division. Dr. Daniel Mays is our lung pathologist and is very engaged when it comes to the didactics for the fellows. And Dr. David Armstrong is our rheumatologist at the VA hospital, and he's actively participating in the ILD program, ILD meetings, and very engaged in the didactics as well. Our graduating fellows for the past June of 2025, this is our former third-year fellows. 3 went to private practice and 1 started doing a sleep fellowship. Every year we average about 1/4 or 25% of our fellows stay in academic, and those that stay in academic have done an additional fellowship, most commonly IP and sleep fellowship. As I mentioned before, we've been lucky enough to have fellows that stay in our division, and that says a lot about our division. And then these are the second-year fellows and first-year fellows. Our fellowship is based out of 3 big sites, although our fellows rotate in more than 3 hospitals. Our main academic hospital will be the University of Louisville Hospital. It's a trauma hospital, a referral center. It's over 400 beds. Currently, they're building a new wing that should be done by 2026. From the pulmonary critical care standpoint, we have 2 big rotations, which are the University ICU and the Pulmonary Consult Service. The University ICU is a team composed of residents, med students, attending and faculty. The census ranges between 15 to 20 patients. In extreme situations, especially in the winter seasons, the census can go up to higher than 20 patients. This usually tends to be the most popular critical care rotation among fellows. Our pulmonary critical care service is heavy on procedures. Fellows get a significant amount of advanced bronchoscopies aside from our basic bronchoscopies. Dr. Gahar is responsible for this service for over 75% of the year. In addition to these two main rotations, we have the non-medical ICU rotations that the third-year fellows have to complete, which are the trauma ICU, the neuro ICU. And aside from that, we have additional elective rotations that are done at the university hospital, which are nephrology and radiology. About 2 blocks walking distance from the university hospital, we have the Jewish hospital. It's a big hospital. It's a different kind of patient population than what we see in the university hospital. Jewish hospital focuses on heart disease and or solid organ transplants. It's a 400-bed hospital. We have a big ICU. At Jewish Hospital, we have 2 teams at the ICU. One is composed of faculty with advanced care practitioners, and the other team is a faculty with a fellow APPs and occasional family medicine residents and some internal medicine residents that want to do pulmonary care. We are responsible for every patient that is in the ICU, including the surgical and neurosurgical patients. We co-manage those patients with surgery. And we are consultants for CCU services and the heart failure services. It's where we have our inpatient service, where we mostly admit CF, pulmonary hypertension, and a patient with primary lung disease that are being taken care of by our academic practice. We also have the CV ICU, led by anesthesia critical care, where the fellows get the ECMO exposure and advanced invasive modalities for heart failure. Attached to Jewish Hospital is the Kindred Hospital, which is an LTAC hospital. The consult service covers some of those patients that are being admitted for ventilator wean. And then attached to the Jewish Hospital is also a big rehab hospital, where we mostly see patients with stable lung disease, or we get patients that are being weaned off their tracheostomy. There's a private hospital in the street parallel to the Jewish Hospital or local hospital. We occasionally go to that hospital for services such as transplant, CF, and interventional pulmonology. Lastly, we have our Robley Rex VA Hospital, 3.5 miles from the downtown medical center. It's a smaller hospital, a 100-bed hospital. We have all the services there. We have a medical ICU, a step-down unit, and then a very procedure-heavy consult service, also led by Dr. Gahar. We have all our specialty clinics except the pulmonary hypertension. We have an interventional pulmonary clinic, sleep clinic, ILD clinic, lung cancer clinic, and of course the general pulmonary clinic, which is led by our pulmonary fellows. Important things about our curriculum. We are currently revamping our ultrasound curriculum. We've had an ultrasound curriculum dating back to 2018. It's a combination of in-lecture case discussions led by Dr. Cavallasi and bedside teaching, led also by Dr. Cavallasi and some of our junior faculty that are connected to do ultrasound. We're currently looking to have a collaboration with anesthesia and surgery critical care to further enhance the experience for ultrasound curriculum. All our fellows are credentialed and comfortable to do basic echocardiography, pulmonary and abdominal ultrasound by the end of their fellowship. We are moderate-sized division and a moderate-sized fellowship, but we have all the components of a big program. We have a lung transplant program, a pulmonary hypertension program where we do all our right heart caths. We have an ILD program, which is multidisciplinary and hospital-based, that includes resources as a program coordinator, a pharmacist, and an educator. In addition, it collaborates with pulmonology. We have a very busy interventional pulmonary program where our fellows are currently being trained for advanced procedures, including robotic bronchoscopies. We have cystic fibrosis program sponsored by the CF Foundation, and we have a sleep program and a sleep fellowship led by 4 of our pulmonary critical care faculty. Things that we've been working on for the past few years and that have started and that are coming soon. We used to have a home call system. Now our call is a night flow service. Our rotations are 2-week block rotations instead of monthly or 4-week rotations. That led to an increase of subspecialty rotation and elective time. We have formal clinic blocks where the fellows rotate among all the subspecialty clinics. Fellows get an additional research protected time. There is a resident boot camp led by our senior fellows that is composed of education about ICU and procedure skills, a multidisciplinary IOP program, and this year we got approved for a nephrology critical care track. We're currently in the process of interviewing. Louisville is a great city. Please make sure you do your research about our city. These are some important historical facts of our city. Please follow us on social media. We have an Instagram page, and more importantly, please look into our website where we have descriptions about the faculty, the fellows, our program, our division, our clinical trials, and also we have a great frequently asked questions section where you can look into important questions that you may be asking before meeting us for your interview. I hope this was very helpful, and I hope to get to meet you all soon.